PRP means?
Absolutely. So PRP stands for platelet-rich plasma. And basically it is drawn from your body, and we spin the blood down, and we basically take the plasma or the platelets from that blood that's spun down, and we apply it to various parts of the body. So Vampire is a trademark. Dr. Runnels invented the procedures, and we are part of that organization. He offers great training and really good science behind the procedures. So we decided, that's what we want to be a part of. And so there's some different applications that we do with it. Some other areas we use the PRP on is we've done the O shot and the P shot. That's for sexual health for men and women. O shot is for women. We do that here in the office, and that helps with orgasms. It also helps with vaginal dryness and pain during intercourse. It helps with urinary incontinence. They found that with those injections, that the vaginal mucosa becomes moistened. Where we inject it helps create some strength between the vaginal wall and the urethra, which will help with urinary incontinence. And women have had better and stronger orgasms with it. So great procedure for anybody. And even if you didn't really have any issues in the sexual department, if you've ever had kids, you probably know that you dribble or leak. And I have women that have never had kids and they still have issues with incontinence. And that's because that tissue gets thin, it atrophies, you lose collagen in the area. And so having, a little bit of PRP in that area will definitely beef that up. And then men will have the P shot. And that's injections into the penis that helps with sensation and basically overall sexual health, sensation, up to improvement in orgasms as well.
Wow. And then, I didn't realize that's from the PRP. So you'd have to get your blood drawn before the O shot and the P shot?
Yes, correct. All of those Vampire procedures. And then they have a procedure called a wing lift. And when I first heard about this, honestly, it's kind of funny. I thought it was, these little wings in the back of your arms.
Your bat wings?
But no, they actually, we learned how to do labial injections. So for women that have atrophy of the labia, we inject fillers and then a little bit of PRP, and that plumps them up and helps restore the volume that they can lose with aging. Another area, they call it a breast lift, but it really isn't much. It's not like a breast lift you would get if you went and had surgery, but we've had injections into the cleavage area that helps with that skin that might be a little bit saggy or loss of volume in that area can definitely be restored with the PRP. So
that's awesome. With the wing lift, does that help protect against tearing?
Yes. Yeah, definitely.
That's awesome.
Yep.
Wow. I didn't realize those had so many, even more than just what you would imagine, that they have so many benefits for people who are maybe suffering with some of those problems, because menopause comes with dryness, right? Yes. And things like that.
Yes.
So.
And it's, PRP it's such a great healing medium. And, it's been around for years. We inject knees and hips and, just about any joint. And wow. It's very, very effective.
Wow. What about like for the P shot, the O shot, and the joint injections? Do those hurt a little bit worse?
Honestly, the O shot, no pain at all. People that do have it done that have had some pain is on average rated at 2 on a scale from 1 to 10.
That's not bad at all.
No, which I was amazed. That was my first question when I called to do the training, and they, of course, at the center all had it, and they're like, you would be surprised. The topical numbing really is amazing, and it's a very comfortable procedure.
That's awesome. Good to know.
It's the thought of that needle going into those places, and I think I have more of a reaction out of men. They're like, "Oh my God, you did what?" But the guys, they just were like, "Oh yeah." I think they were more afraid, and they're like, "Yeah, it just feels different and more of a pressure, but very tolerable."
Well, and
very,
especially for the results that you're going to be getting. It's kind of
yeah,
that, no pain, no gain,
yeah,
you're willing to go
absolutely.
a little bit. So in that same kind of sexual health note, you have something called a V-Fit. So
Yeah.
what is that and who's it for and what's it do?
So the V-Fit is a great device, and we actually paired along with the O shot, and that's after we had talked to other organizations and clinics that were using it and pairing it, because it uses low level red light and basically helps vaginal health. So treating, vaginal dryness. If you have, after having kids, your pelvic floor relaxes, you just don't have the elasticity that you did when you were 18. So this uses red light to help restore that collagen, and the device looks like this.
Okay.
And the treatment is every other day. You do it 3 times a day, and the heat level is started out on a lower level, and then with each, there's a treatment plan, and with each subsequent treatment, that heat will go up to the maximum that's already set on the device, and up to 12 minutes. You use it every other day, and
Okay.
it is very, very effective. They say that 9 out of 10 females from their study experience significant improvement in symptoms. So basically anybody can use it. There's really no contraindications. And it also, they can't say it improved sexual function because that wasn't the focus of the study. However, the patients all reported improved sexual function. And they also use a little bit of a hyaluronic hyaluronic acid gel that is used during that red light therapy to maximize the effects of it. So this one I haven't used, but I'm going to soon, because we all got one. So
yeah, no, that's
we can
awesome.
talk about it again later. I'll let you know if it works.
Yeah, let me know. So it was originally for more like incontinence or?
Yes.
Okay.
Correct.
So if you're struggling with that.
Yes. So if somebody has painful intercourse, this is very, very good for that. Vaginal dryness. It does help with urinary incontinence as well.
And is that something you rent out then, or you buy?
You purchase it. Yep.
Okay.
And if you do the O shot, it comes with that. We've included it in that price. Yep.
Oh, that's awesome, because they just work so well together.
Yes.
That's so good. I just think about all the women I know who tell jokes like they can't do jumping jacks and they can't do all these things. And what a nice way to get your kind of life back if that's holding you back.
And I feel like, because I have that, I can definitely be, a good person to talk to, because I ended up doing, so when we went to training, you trained on another participant, and then they trained on you. So I had the O shot, I had the facial lip, the facial, and honestly, I felt more with the facial than I did with the O shot. And does it work? I wasn't going to do it, but then they talked me into it, because they said, clients are going to want to know how this feels. I felt absolutely no pain whatsoever. And I can tell you, I couldn't do jumping jacks. I couldn't jump really doing anything, because or if you coughed or sneezed, you end up peeing your pants. It was 100% effective for me. It has done wonders in that department. So, and I don't say that, so, hey, come on in so I can do this. That's an honest response. And that's people that know me. I mean, I want you to leave here happy, and I want to set up expectations that are
realistic.
That are realistic. And I'm not a salesperson whatsoever, but I can tell you, in talking with other people that have had that procedure done, it's very effective. And even more so with the V-Fit.
No, I think that's awesome that you were brave enough to do it, because it is scary, but I think for someone out there who is struggling with that to know, okay, she's done it. I know that it helps. It's not going to be something in vain. That's awesome. I had no idea that you guys did those things and what they involved. So thank you for educating us on that.